Hello and welcome to Founders Amplified, where we spotlight underrepresented founders who are driving innovation and impact across various industries and sectors across the globe. I'm your host, Narayan Kulkarni, and I'm excited to be here with you today. Today's guest is Osei Boateng. Osei Boateng is a visionary healthcare leader and a social entrepreneur dedicated to transforming access to primary and preventive healthcare in underserved communities. With a background in biology, a master's in healthcare administration from Cornell University, a master of business creation from the University of Utah, and over 3 years of hospital administration experience, Osei channels his expertise and passion into building innovative, sustainable healthcare solutions in Ghana and beyond. Inspired by personal experiences growing up in rural Ghana and witnessing the devastating effects of delayed care, Osei established the foundation to bring healthcare directly to the doorsteps of those who need it most. Through OKB's flagship mobile medical unit, Osei has reimagined healthcare delivery in hard-to-reach areas. The foundation's mobile clinics travel across rural regions, providing free primary care, diagnostic services, medications, and health education, and have served over 15,000 individuals across 100 rural communities. Osei is a 2023 CNN Hero, 2023 Young Global Changer, 2025 Healthcare Hero of the Year, 2025 Joy Impact Maker Award winner, 2025 Global Citizen Grand Prize winner, and 2025 Praxis Nonprofit Fellow. Osei's long-term vision is to revolutionize healthcare delivery by shifting from reactive to proactive care, ensuring that no one is left behind due to geography or poverty. So, now that you know a little bit more about Osei, let's dive in to the conversation. Welcome to Founders Amplified, Osei. It's great to have you with us. How are you doing today?
I'm doing pretty well by the grace of God. What about you?
I'm also doing well. I had a few internet issues before this, but otherwise doing really well. And again, really excited to be here and have this conversation with you. So to kick things off, I'd like to hear a little bit more about your journey. So could you please tell me about why you decided to become a founder of your foundation, and if there were any particular moments or experiences that sparked that decision?
Yeah, definitely. And once again, thank you so much, for this opportunity to, have this session with you. So my name is Osei. I was born and raised in Ghana. I lived in Ghana for the most part of my life, before having the opportunity to travel, to the States with my family. But growing up, I grew up in a very small community in Ghana where access to healthcare was a challenge. Most individuals in my community had to travel several miles to get access to basic health care. And even with that, it wasn't any guarantee that they would get to see a healthcare provider. And so that happened to a lot of people in my community where they go to the hospital and then they have to debate whether they are going to live or die just because, access to healthcare was a challenge. And personally, that happened to me. When I lost my grandmother and my auntie, we were able to get them to a healthcare facility, but weren't able to get a healthcare provider in time to take care of them. And by the time we got one, it was too late, and we lost them. So since then, I said to myself that once I become of age, I want to devote my life purpose to ensuring that people living in rural and underserved communities have access to basic healthcare. And to put things in perspective, I'd like to let people know that in Ghana, we have about 13.9 million people who still live in rural communities, which is about 40.1% of the population, and less than 2% of them have access to basic healthcare. So there are millions still living in rural communities who are still struggling to get access to basic healthcare. And so from our work, we have interacted with a lot of people in the rural communities, and we've realized that to address the healthcare accessibility, they needed something that can come closer to their doorsteps. And that is how we founded the OKB Hope Foundation with our mobile healthcare unit that goes to rural communities in Ghana to provide them with primary preventative healthcare, maternal, chronic disease management care right at their doorstep. So we run like pretty much a doctor's clinic on wheels. I mean, where we bring this healthcare to their doorsteps. And for me, the personal experience that I had growing up, and also the loss of my grandmother and my auntie, was the fuel that brought me to this founder adventure in creating a solution to address the healthcare gap.
Wow. First of all, I'm really sorry to hear about your grandmother and your auntie, and I'm also very energized to hear that you have devoted a sense of purpose and created a really exciting and important solution to address this issue. Also, thank you for enlightening our audience about like the number of individuals in Ghana who live in rural communities. I know a little bit about that because I mean I've not only studied geography, I've mentored a number of people who live in Ghana. Who not only both live in like urban places like Accra, but also
Right.
go to rural communities and do a lot of work, but in other spaces like education. But our audience may not know that, so I appreciate that you shared this for those that may not. And I also appreciate hearing, yeah, those aspects of your story. And I would like to learn a little bit more about this part. So, could you please share with our audience other aspects or a little bit more into why your story and your identity gives you a unique edge in being a founder in your foundation?
Yeah, so for me, since I had a lived experience and really witnessed the struggles people go through accessing healthcare, it gave me a deep understanding on how people live their lives. So, for example, I know that most of the people in the rural communities, they work informally, which means that the more they sell their products on the market, that determines the money they get, and that determines the food they put on their table. So, for example, if they go to the market and sell a bag of tomatoes, the money that they would get is what determines like their daily, food, or how they can support their family. So, for someone like that, telling that person to stop and go to the hospital with no guarantee to see a healthcare provider is a big ask. It's pretty much telling the person forfeit your daily wage and go to the hospital, which is not even guaranteed that they'll get to see a healthcare provider. So for individuals like that who depend on that, they would have to make a huge decision. And most of the times, according to the Maslow, theory, it's like they will want to fulfill their basic needs, which is food and caring for their and shelter for their family before they think about other things else. So a lot of people would consider doing that and think about healthcare as a last resort where they don't have any options. So being in the community, having the lived experiences, talking with people like that gave me this deep understanding of how to address or develop a solution that fits their lifestyle. And also, being from the same community, growing up there, really helped my self-identity, right? So growing up, we really saw how important it is to be in community or be in fellowships. Everyone in my community knew each other. So we lived in a community where you can literally leave your child with another family and everything is safe. You just come back, and so that fellowship really built my self-identity. And that is how I even lead my organization in terms of like I see them not as employees, but I see them as family. And it's not more about only the work, but I'm also concerned about their personal life and their whole being. So that experience really shaped my self-identity and has also really shaped how I lead in the organization.
Wow, thanks so much for sharing.
Mm.
Some things that really stuck out were, first of all, I appreciate that you talked about Maslow's hierarchy of needs. So yes,
Yeah.
the like survival needs at the very
Mhm.
bottom are extremely important
That's
for
right.
anyone to then progress up to other places like for belonging, self-esteem, etc.,
Mhm.
all the way to self-actualization. The other thing which I appreciate that you shared was that you have lived experience in that community and
Mhm.
also connecting with and like the value of family in your upbringing. I appreciate hearing that how that translates into the how you not only interact with individuals at a personal level, but also simultaneously interact with them in professional ways.
That's
So I
right.
appreciate hearing that very much. The next thing which I'd like to talk about, and which you mentioned a little bit when you talked about how you have a mobile health unit.
Mhm.
But can you tell me a little bit more about what is unique or innovative about what you're doing in
Mhm.
like your particular context? And what people, if they look at what you're doing, they think, oh, okay, that's unusual, or
Mhm.
oh, that's very new. Can you
Mhm.
talk a little bit more about that?
Yeah, sure. To even dive into our solution, I would like to give a little bit background about, the healthcare system in Ghana, right? So in the healthcare system in Ghana, what we have is the community planning and healthcare services as the basic. So typically, in short, they call it the CHIPS compound, right? So these are smaller buildings that they build in communities, with the hope that they provide basic first aid care and health education. So if someone is sick, the first place that they go to would be the CHIPS compound. If the CHIPS compound cannot handle that, then they go to the health center. So it's more of a referral basis. So from the CHIPS compound to the health center, to the district hospital, to the regional hospital, to the tertiary, depending on how severe your case is. So through all these, all of them are brick and mortar buildings. So individuals still have to walk to that building. And so then if you are living far from those buildings, that become a big barrier for you accessing healthcare. And so what makes our work unique is how do we bring this care to their doorsteps? So pretty much our mobile healthcare, I would say, is a clinic on wheels. So we go into communities with seasoned healthcare providers, so doctors, nurses, lab techs, pharmacists, and then once we are in the community, we set up like a hospital. So you go to registration, you go to your nurse to check vitals, you go to your doctor for consultation. If there is any need for lab, we carry about 10 to 12 point of care diagnostics in the van. So within a matter of 15 minutes, you can go to a nurse, get your consultation, get your lab done, and get medication, and then go. So it's everything is pretty much like a one-stop shop for everyone who comes into our van. And so even with the traditional kind of space, the doctor can tell you go do the lab at a different place. Then you have to come back with your lab results, and then it will tell you that now go to the pharmacy to get medication. So there are a lot of fragments that patients have to go through, and it could be really frustrating if you are sick and you tend to be sending you around, go here, go here, go here before you get the care that you need. Can really affect the patient experience. And so this is one thing that makes our work unique. But most importantly, when we are in the community, we are able to observe other socioeconomic factors that contribute to the overall health outcome of the community, right? So there have been instances where we've been to the community, we've seen a lot of cases of people coming with skin rashes. So what that prompted is like, what is the root cause of that? What water are they drinking? And so with some communities, we had to investigate, go there, see the water they're drinking, and realize that no, the care that we are giving is just a band-aid. The real cause of the issue is that they don't have a potable source of water. So even if we provide the healthcare that is not solving the problem. The problem that needs to be solved is the water that they are drinking. Whereas if someone is walking to a traditional building, what the doctor is seeing is just one patient coming with a skin disease. The doctor is not able to figure out the root cause of that. So these are all the advantages or like what makes, our work very unique. It's not just giving care, but also understanding the root cause or the socioeconomic factors that contribute to the overall health outcome of the people and the community as a whole.
Well said. So, first of all, I appreciate hearing that what you're doing with your mobile health clinic is, of course, centralizing services,
Mm,
providing access in a way that is unique and innovative in the particular context that you're
mm,
in Ghana, but also something which I appreciate hearing again as someone who has
mm,
public health training, who is also like who is I know like studied health administration. I've also studied
mhm,
health administration in the U.S. But in a school of public health, I
mhm,
have. So I have that public health angle. Social determinants of health are really, really important.
mhm,
And when considered, as you gave that example,
mhm,
when addressed, that has a lot of downstream positive impacts if addressed positively. And this is why I'm also curious. Can you tell us more about, and our audience more about, how tangibly in your care model you account for and address social determinants of health in a way that maybe others in like other healthcare
mhm.
models in Ghana might not.
Yeah, so one
Beyond just centralizing like providers and being just aware of what's going on.
Yeah, so one way that we've addressed some of the socioeconomic factors has been, some communities that we've been, we realized that, the issue that is causing their diseases was like the lack of potable water. And so for us, we were able to have a partner who came in, who was, a partner who is interested in building boreholes, and the partner built a borehole for that particular community. There were some communities that we went there and we realized that getting shoes for the kids to use to go to school was a challenge. So what it meant was that people would have to walk barefoot, which most likely cause food diseases and some other neglected tropical disease. And we're able to work with another partner called Samaritan Feet to come provide, free shoes, for the school children. So these are examples of the work that we have been able to do to address the socioeconomic factors. I see our work as at least the catalyst, for community building because we go there, we see the problem, we know that we cannot provide water, we know that we cannot provide shoes, but who is in the world who is doing this and whose focus is on water, whose focus is on shoes, and then how do we partner with these people to bring those resources to the community that we are serving so that we do what we do best, which is healthcare. They do what they do best, which is provision of water or provision of shoes. And this become more of a collaboration to make a bigger impact rather than we just doing it ourselves.
Well said. I love how you share this example of how partnerships
Mhm,
can enable one to not only specialize in one's work better, but also enable other impacts that
mhm,
help the partner and also create a shared goal that is like really has positive ripple effects.
mhm,
And to this point, can you tell us more about the impacts that you are seeing in your work? And also to fast forward and also to zoom out,
mhm.
say like in 5 to 10 years, what are some of the positive impacts that you're seeing in the population whole that tells us, okay, your solution's working? And of course, not just healthcare, but also in terms of other social determinants of health and other like positive impacts.
Yeah, so right now, with our mobile medical unit, we've been to over 80 rural communities across 7 administrative regions in Ghana and have served over 10,000 people across these regions. And we don't do only rural communities, we also work with underserved populations such as, inmates in prisons. We've provided medical care or gone to, prisons to provide care for these inmates. And so this is the impact that we've had so far. And zooming out in terms of like what do we see or what impact have we seen is, I mean, I like to give an example of, a particular person that we've been able to make an impact and seeing that. So that could be one example or story was one community that we went to, right? When we went there, most of the kids malnourished, when we did the lab test, all of them malaria positive. So you could see that they're really sick, right? And we went there the first time, did the screening, provided them with the needed care and we went there the second time. And when we went there, we saw all the kids running around happily. So that moment really, we really saw the impact that we came to, provide for the people in those, particular communities. And during, giving care, we interact with the community members. So we are asking them, so how were you guys going to access healthcare if we were not here? And they were like, we had no idea because where we are, it's really removed, from the city, and no one ever comes to that place. So it's like, okay, there's no way they are going to access healthcare. It's more of like, okay, we are just gonna be there, and if we die, then we go. So to be able to go there and be that source of hope, bring healthcare to their doorsteps, and go there the second time to see all the kids happily running around, is very, very impactful to us, and that keeps us, going even when we come across obstacles and challenges. By in the next 5 to 10 years, my goal or the goal is that we are able to change the culture of reactive healthcare to a more of a proactive one. So right now, because of the limited resources and things like that, people would only access healthcare when they don't have any other option. I already described how their work come in place. So it's like they would only access healthcare when it's late, which makes it very difficult to treat, which means poorer health outcomes, right? And very expensive. And so in the next 5 to 10 years, our goal is like, how do we bring preventative primary healthcare to the doorsteps, to these people, health education, so that now they are more empowered and equipped to take care of themselves, because we know that knowledge is power. And the more people know about the importance of different ways they can live their life to be healthy, goes a very long way for them to live a healthy life. So the next 5 to 10 years, the goal, the shift in culture is the reactive to proactive healthcare, for the people that we are serving.
Wow, I appreciate your perspective on how knowledge can have multidimensional shifts in the long term, and also just the emotional well-being that
Mhm.
can come. And really, I appreciate the example that you shared
Mhm.
of like seeing the kids that you had once served being
Mhm.
very happy as a result. So thanks for sharing those
Mhm.
examples. Now, sounds like you've had quite the journey in
Mhm.
setting up the mobile unit, going to so many different rural communities in Ghana to like deliver care, work with partners. So, can you tell our audience what are one or two things that you know now as a founder
Mhm.
of your foundation that you wish you had known prior to beginning this work?
Wow, that is a great question. Um, I one thing that I wish definitely I knew before going into this was how hard it is. Starting something off the ground, yeah, it was difficult, right? Sometimes you're like, should I give up? Because it's not easy starting something off the ground, and you know funding delays and trying to raise funds and things like that to make it happen was challenging. So if I knew that it was hard, maybe. I don't know if I would have gone that route, but definitely I think God had his own plans for me. But one thing that I really wish I knew was like really understanding in the some of the regulations and the policies around mobile healthcare. For example, in Ghana, there wasn't anything like that. So they didn't have any licensing for people to run mobile healthcare, right? So what that meant for me or for my team was to have a brick and a mortar building, and then get that license before we are able to operate the health mobile medical care, right? So we had to make an investment that wasn't planned for to get a brick and mortar before we can do that. So I think if I knew how the policies were structured well before starting that, probably I would have, taken a different, sort of approach in doing this. And definitely, once I got to know, now my goal is how do I now advocate so that it becomes easier for people who wants to do mobile healthcare to be able to do that. So that is some of the stuff that I would say in terms of like some things that I knew, going there. But I think other things that I also came across is that, speaking with people and having interaction with them, what I saw or learned was that everyone wants to feel valued, whether they have money or they don't have money. So most of the, comments that we got from most of the community members that we are serving was like, you know what, when I go to the hospital, the doctors don't have time for me. It's like I go there, they ask me what's wrong with you. I tell them headache. Okay, they tell you, okay, take this medication, leave. So like it was more of like they didn't feel um I guess they didn't feel the easiness to ask questions or to express themselves. It was like, okay, this is wrong with you, get this and leave, kind of situation. And so that was one of the comments that we got that prevented people from seeking care because they were like, yeah, if I go, they're not going to treat me well, so I would rather not go. All right. So these are some of the things that we learned. We saw that, you know what, whether the person is paying zero CDs or paying thousand Ghana CDs, everyone needs to be treated equally, no matter who they are, their socioeconomic background and things. So that has really influenced, even the way that we approach our work and how we serve people. And all this came by, learning and also asking questions, from the people that we are serving.
Wow, thanks so much for sharing. It's really cool to hear about, for example, policy
Mhm.
and like how to connect with people in the community to deliver
Mhm.
care. Can you tell me more about one or two things about managing an organization or founding an organization
Mhm.
that you wish you had known before you'd started?
Yeah, so one thing that I wish I knew before, started on managing people is that, definitely people are different, have diverse background, have diverse opinions. And so like something as a leader, you think is a small thing that we need to make a decision on could take a couple of days for you to bring people together. But the thing is that as a leader, it's important that everyone also buys into it. So even though you know that this is the response or the answer that you want, you have to make sure that all the stakeholders buy into it before that decision is made. Because then, if you make the decision without their buy-in, that means the work is not going to be done as you expected. So, I wish I knew that. To really have a successful organization, it's not about the programming that you do, or it's not about the things that you do. It's about how best you are able to manage. Your employees. I wouldn't even say manage, but how best you are able to create relationship. With them. I know that in the traditional way, everyone will say that, customers first, what customers are right. Like, let's make sure that customers get what they want. But I am of that perspective based on my work and what we've done is that employees first, because if employees are empowered and equipped and feel comfortable, doing their work, then they will better serve your customers and then your customers will be happy. So that is, some of the things that I've been able to, learn. And, once you are coming into leadership, the training is like your customers are right, the customers are first. But through my work, I had to learn that, you know what, not the customers, but the people that I'm working with are first, because once they are well taken care of, my customers will be well taken care of.
Gotcha. Amazing leadership lessons, much appreciated.
Yes.
So, how can people find you and how can they support your work?
Yeah, so we always, welcome, collaborations, partnerships. So just because we know the work is huge, we cannot do it alone. And so people can find us on all the social media platforms. So LinkedIn, Twitter, or X, TikTok, Instagram, Facebook, and the name is OKB Hope Foundation. They can also follow our website, go on our website, sign up on our newsletter where they will receive monthly newsletters from the work that we are doing. And so in terms of partnership, collaborations, we are in the healthcare space. So if there's any healthcare provider out there who wants to come and, provide or serve rural community members, we are always welcome. If there is any medical equipment, organization that wants to, come in and support the work that we are doing by, supporting us with supplies and medical equipment. That is also something that we greatly appreciate, just because we know the work is big and be able to do this and do it well, we need, partnership and collaboration. If you cannot support at all, and you are able to even share our work to your network, that is also really appreciable. Yeah.
Thanks so much for sharing. Now it's time for our signature question. So can you please fill in the blank? I amplify.
I amplify the the concerns and the needs of rural communities so that they are able to get the support that they need to thrive and flourish.
Well said. And again, thanks so much for joining us today on Founders Amplified, Osei, and for sharing your amazing journey and insights. It's so cool to hear about what you're doing in providing mobile health and like serving rural populations in Ghana with OKB Hope Foundation and all the different impacts that that enables. And I also just want to pause and reflect on this conversation and just celebrate you as a person who is an inspiration for underrepresented people and founders everywhere. So as I think back to some of the things you've said, some things that really stick out are I appreciate the intentionality, the passion, the purpose that you have coming from challenging situations, but then going ahead and doing something positive with that. Something which I also appreciate is, of course, it takes a lot of courage and a lot of dedication to serve rural communities anywhere, but also in using innovative models. And also, sometimes people who come from any community, it can be uncomfortable to look back at one's past or go ahead and like try to like move forward because that can bring up familial things, or sometimes it can be sometimes challenging to challenge a status quo. So I applaud the courage that that takes. And also something you mentioned a few times, which I admire and I very much appreciate, is always keeping family, community, relationships in
Yeah.
center, whether that's in just the business partnerships or just going ahead and connecting with fellow people that you grew up with or in that
Mhm.
community, or just people who are providing healthcare. So these are some things that I applaud in you and I heard, and I wanted to celebrate. And thank you for embodying those and sharing those with our audience, Osei. Much appreciated.
Yeah, and thank you so much for the platform to share our story. We don't really take it for granted because the more we are able to share, the more people get to know about it. And most importantly, probably our story will also inspire someone to also start doing something in their community to address the challenges that they are facing. So thank you so much, for this platform to share the work that we are doing. I appreciate it.
You're most welcome. I
Yeah.
look forward to staying in touch, but I I know like well, I'm sure we'll have many conversations, but I would like to say goodbye for now. So bye, Osei.
Bye.
To our listeners, thanks for tuning in to this episode of Founders Amplified. I hope you're feeling as inspired as I am. If you'd like to learn more about our guests and support them, check out the show notes for their details. If you enjoyed this episode, please give us a rating, share it with someone you know, and follow us for more inspiring episodes like this one. If you're a founder who is driving innovation and impact in any industry or sector anywhere in the world and would like to be a guest, we'd love to hear from you. Check out the show notes for more information. And finally, remember that you, yes, you, have the power to amplify the voices around you. Whether you're a colleague, family member, friend, funder, mentor, or just another fellow human, your support matters. So I invite you to celebrate and uplift the underrepresented innovators in your life who are driving innovation and impact. Let's create a better future for everyone, together. Until next time, stay curious, stay bold, and keep amplifying.